Ciao a tutti, benvenuti al mio canale House Made Easy, un canale di studio, ripasso e riflessione per gli studenti sociosanitario. Hi to you all, welcome back to my channel. In today's video, I'm going to talk about an interesting topic that normally we get confused on how to use them, or normally people used to mix them and we don't know the difference between the two. What am I talking about right now? I'm talking about the auxilio and the presidio. So join me as I take you through the definition of the auxilio and also the definitions of the presidio, the various types of auxilio. What are they? What do we use them for? Also the types of presidio, what are they and what do we use them for? So if you are here and you are taking the course to become operatore socio-sanitario, this channel is for you. On this channel I do explain many of the subjects and also the topics that we treat or we were taught in class, and normally due to the language barrier we find it difficult to understand. So on this channel I explain everything in English with examples so that you could get a clear understanding of what you are being taught in class. So if today is your first time watching my video, please subscribe to my channel, like my videos, recommend them. If you have any question, if you don't understand any topic, any aspect of the course, please comment in the comment section so that I will know how to help you and we all grow together. Join me and let us all learn together as I take you through the presidio and the auxilio. So guys, let us get started. When we talk of auxilio, the definition: qualsiasi strumento o attrezzatura che aiutano all'autonomia della persona disabile. So when we say auxilio in English, simply means aids, something that aids or offer a help to the person. So the auxilio, they are all those tools that are used to make the patient perform actions or movements that he would otherwise be unable to perform. So these auxilio are usually used by people, above all people with disabilities. They are also used in other cases of temporary inability to carry out certain actions, such as after a major surgical operation or somebody with a temporary paralyzed issue. We use this auxilio to help those people to perform movement and also make actions. So these auxilio, they are products and also equipment that are used to help people or patients, not only patients, people with disability, people or elderly people, or somebody with serious chronic issues. The person can't walk temporary or anymore, the person can't perform any actions. So we use these products or this equipment or these tools or these technological systems to help them to perform their activities. These are auxilio. So let's look at some of the examples. Examples I've written here. We have the carrozzina, we have stampelle, we have arti artificiale, girello, letti ortopedici, etc., etc. So these technical aids, they are the wheels, the walking sticks, and also the artificial limbs, and also any tool or anything that can help the person to perform activity or to perform movement. We also have the anti-decubitio system, that is the cuscino that we use in the posture of the person. So all these tools are also called auxilio. Now, hello guys, let us see some of the tools and equipment that are used for movement and also performing actions. So here in this video I have here what we call the sollevatore, which is used to lift patient from bed to wheelchairs and also from wheelchairs to bed. We also have our carrozzina, which help patients to move around houses, move outside, and also perform movement and action. We have the girello, we have bastone, we have the deambulatore, due puntali, due rotte. We have the stampelle, and we also have the cuscini antidecubito. These cuscini antidecubito, they are used in postura. Postura means that there are patients who are in bed always. So every 2 to 4 hours, we need to change their position. If the person is being positioned to the right side, around 2 hours, we need to position the person again to the left side to be able to prevent lesioni da decubito. So these are the cuscini that we use to do the postura. Since the person is rigid and cannot assume the correct posture, we need to use this cuscini to help the person to get the right position. So these are the various or some types of the Ausili that I can show right now. All right, so let's move on. So guys, let us move on to the presidio. When we talk of the presidio, sono oggetti o prodotti che aiutano a prevenire, curare determinata patologia. So these are the presidio. They are devices, instruments, substances, or products that are used to diagnose or self-diagnose, to prevent, control, administer therapy, or mitigate a chronic or temporary illness. So these presidio, they do not carry out any action on the human body. As for the auxilio, they carry out actions and movement on the human body because they help the person to move. But the presidio, they do not cause any action or movement. They are used to control. They are used to prevent. They are used to administer or mitigate therapies. So these products or these substances, they are used in situations like incontinenza. When we say incontinenza, it means incontinence in English. Somebody that does not have the voluntary control over their bladder. So they urinate without knowing it. And then we use this cathetere vescicale, which is a flexible tube used to, placed inside the bladder of the person to collect the urine or to drain out the urine. They are called the urinary catheter in English. So this urinary catheter is presidio. It's a presidio. That means it is a product, a flexible tube, like silicone-like tube, that is placed inside the bladder to help collect or to help drain the urine, because the person don't have the voluntary control anymore. They can't urinate on their own. So this catheter helps the person to drain out the urine. So this catheter becomes a presidio. We also have the pannolone. Pannolone, they are the big diapers for the elderly people, and it is also used to treat incontinenza. Incontinence, I have already explained, somebody that do not have the voluntary control over their urination or defecation. We have the striscia, we have sagomato and diaper pants. The striscia and the sagomato, they are all urinary products. They are used to treat incontinenza, somebody that cannot urinate on their own, or they don't have voluntary control over urination and also defecation. We also have other medical devices. We have products like the gel that we use to we use them for gel hygienizante. They are all procedure because during the COVID we use all these gel, we rub them in our palm to help us prevent being affected by the COVID virus. So the gel alcohol that we use them becomes a procedure. So as I am saying, this procedure, they can be either substance, they can be either product, they can be software or anything that help to prevent a disease or that help to prevent a situation, chronic situation or injuries in the person. Example is the incontinence. We have the diapers, we have the catheters, we have the slippers, and also the containment bags. We also have the sack that we use them to collect the urine. They are all procedure. We have bandages that are used in various type of injuries. They are all procedure. We have the devices for diabetics. Those devices such as the insulin pumps, the syringe, the finger pricks, and the test strips, and also for monitoring and also testing the blood sugars, they are all procedure. So as I'm saying, the procedure, they are substance, tools, devices, products that are used to prevent or that are used to control certain pathologies. So they do not cause movement or action on the body, but auxiliary cause actions and perform movement in the body or on the person. Let us see some of the examples of the procedure. So guys, let us see some of the tools and also some of the products that are known as the procedure. The image is not clear, but I have to use it anyway. So in this image, you can see the sack that is used to collect urine from the catheter. You can see the diaper pants. You can also see the sac which is used for stomia. Stomia means that somebody that cannot use his or her natural anus to pass defecation, and they have created, or he has been operated on, and they have created a hole through the stomach. So that is where the person passes feces, and we use this sac, which is the yellow or brownish color here on my left. Those are the products or the materials we use to collect the feces. We also have the device for monitoring the sugar level in the blood. In this video, we also have the bandages. They are all procedure. We have the urine sac. They are all procedure. So any other thing that is used to administer therapy, used to prevent, used to control, they are all procedure. They can also be medical devices. Here we have the diapers and also the pants. The diapers for the elderly people. So these are all examples of procedure. I hope you enjoy my videos. Please like and also subscribe if there is anything you couldn't understand very well. If you would like me to go over anything else, if there is anything I couldn't say well, please forgive me. Enjoy the video and also share them to other people that need to know or need to see this video. Thank you all and see you next time. Bye. Alla prossima.